You're listening to the Health and Happiness Podcast with Travis Kemper and
Lauren Maxwell. Each episode, we share easy to implement strategies to improve your health, happiness, and overall quality of life.
Giving birth should be your greatest achievement, not your greatest fear. Jane Wiedemann. How's it going, Travis?
I'm good. We're going to Mesa Verde National Park this weekend. So we're gonna go there, hang out for a couple days, do a bunch of tours. Yesterday we did a little over 4 miles in what ended up to be a snowy thunderstorm
Awesome.
up the mountain with Duke. Yeah, so it's been very wet here, so hopefully that continues into the winter.
Fingers crossed for a good snow season. Yeah,
I know. How's it going, Lauren?
It's going good. We went to Oktoberfest yesterday and hung out with some friends, which was super fun. And then afterwards, we did a watch party for Hocus Pocus 2, which came out on Friday. I was so excited, but it definitely wasn't like nearly as good as the first one. But I think we all expected it, so it's not like my hopes were up that high. It didn't really follow the book either in terms of like the sequel.
I didn't know there was a book.
Yeah, there's a book. So I was more surprised by that, I think, than like it not being great. I'm not sure I'll be adding this movie into my typical rotation of Halloween movies for next year, but the original will always be on there.
I don't have a rotation for Halloween movies.
Really?
No, the
Mine
only
are
movie
like-
I watch every year is Elf.
Yeah, that's a good one.
Yeah, that's
Yeah.
Christmas time though. Obviously.
Of course.
It's
Yeah.
actually like as soon as Thanksgiving comes around, it's like I'm gonna watch Elf.
You gotta do it. It's a great movie. Yeah,
Mhm.
mine for Halloween is like Hocus Pocus, Ghostbusters, Practical Magic, Halloween Town, like cheesy Halloween movies. Not scary. I don't like scary. Anyway. I also had my students start with me this week, which has definitely been a learning experience so far for both of us. I've
Nice.
been trying to learn more how to like teach someone how to do a skill and like critically think through treatment sessions while really on the fly with kids who have like the tiniest attention spans of all time. Which I think is the hardest part of working with kids. You can almost never have a plan because nothing ever goes according to plan, which I love. Like as a PT, that is now so, I think it's so interesting. I'm never bored. But I know it can be really challenging for students, especially students who were like me, thrive with structure and like pre-planning. I would have never thought I would have liked something so unpredictable, but once you like learn how to do it, it's like the best thing ever. But man, it's hard to teach.
I plan nothing.
Yeah, I mean, I don't either
Like I do it
anymore.
really well, but I plan nothing.
Yeah, I don't plan anything in treatments anymore. I just know goals, and then I go in and I'm like, what is this kid going to be interested in? Okay, how do I make that therapeutic?
For
It's
me,
super fun.
one, I don't have time to do planning for patients because
Mm-hmm.
we see 10 patients a day. But two, I people like rarely come in with the same problem.
Yeah,
Like people come in with their shoulder hurting on day one and I'll give them exercise and they'll come back on day two and they'll be like, listen, my shoulder feels way better. I think I'm just going to keep doing what I'm doing. I've had this lower back pain for 3 months. I'm like, well, we can just do the same things for your shoulder, but then your back's going to continue to hurt. So I guess
right.
we should try and diagnose your back
Yeah,
and figure it out. And that happens, oh my gosh, probably 30 to 40% of the time. So
yeah.
yeah, my plans would be worthless anyway.
Yeah, my plans, I learned very quickly. Like, I would try to come up with like an obstacle course for kids when I first started my job. Like, I would
That's
have this
fun.
all planned out. And then the second I brought them in the room to do the obstacle course, they would say, no! And they would like run away. And then like your whole plan just went out the window. So yeah, I love it now. But man, was it hard to like figure out how to actually do. Anyway, what are we going to talk about today, Travis?
Well, we've joked about doing episodes for you in the past, but today I really did choose this episode for you after a conversation we had last week.
Aww.
Yeah, today we're going to look at why is Lauren insane? No, just kidding. We're going to look, Lauren, I don't think you're insane. We're going to look at whether women having babies over the age of 35 really have an increased risk of child deformities and complications in pregnancy, or if this is just, something that we've heard over and over throughout our lives, but has no scientific evidence. Kind of like a couple of recent episodes that we did on diet, like high protein and meat, where the evidence is pretty solid one way or the other, and it's the exact opposite way of what is
Taught
professed
or
in
yeah.
society, if you want to go with that.
Yes. Thank you for making my heart feel full and then breaking it all at the same time.
I do a good job at that, don't I?
Sure do. So, research on pregnancy has been harder to come by than we thought. And many of the studies that we found are not as recent as we would like them to be.
Yeah, so Lauren and I did a big episode in the beginning of this podcast that we never released, looking at our healthcare system compared to other healthcare systems around the world. We didn't release it because, well, frankly, it was really boring and we couldn't figure out how to make it not boring to listen to. And we didn't want to put that out. But the Cliff Notes is all of the healthcare systems around the world are relatively bad. Ours is one of the best. So, whatever you're hearing on the news, it's nonsense. But one of the big black eyes, probably the biggest black eye in the US healthcare system overall, is maternal health and pregnancy outcomes. Mm-hmm. Knowing this, we assumed there would be a lot of research available, but we were sadly and grossly mistaken.
Yeah.
So keep in mind when we're going over this, and really all of our episodes, that we're using the research that is available today. But this topic in particular is shockingly understudied in our opinions. And I mean, I don't know what the listeners think, but in a society, pregnancy and childbirth are pretty important things if you want to keep your society going, that we should probably care about and therefore study. But apparently we don't. And it's not only us, it's like internationally. Nobody gives a crap.
I mean, there's just like no study, like anywhere. Like it's ridiculous.
Right.
It's
and one of the
shocking.
ridiculous things about that is, as we mentioned, the maternal death rates are high here. And if you don't study why and try and figure out why, trying to decrease those is not going to happen. I mean, like, what are you even going to try and do?
Yeah, it's impossible. We need more studies. People, please study it. So in a 2009 study that we found, birth defects affect 3% of babies born and are one of the leading causes of infant mortality. Both younger and older maternal age may pose increased risks for certain birth defects. More women are delaying childbearing currently in our society, resulting in 14.9% of annual live births occurring in women aged 35 years or older. So this study looked at like both extremes of age and pregnancy. So they compared like teen mothers versus elderly pregnant people, which is 35 and older, according to like that's the terms they use, which is crazy, but anyway. So for teen mothers, births to teenage mothers have decreased in recent years in the United States, but still accounted for 6.4% of annual live births in 2009. This proportion is one of the highest among industrialized countries and represents a tremendous ongoing socioeconomic cost, as numerous studies have determined that teenage pregnancies are susceptible to adverse pregnancy outcomes, including intrauterine growth restriction, low birth weight, and preterm delivery. In a retrospective cohort study conducted in the United States, strong associations between younger maternal age, 13 to 19 years, and certain birth defects in the offspring were identified, including malformations of the central nervous system, gastrointestinal tract, and musculoskeletal system. Interestingly, the maternal age pattern of risk for birth defects differed among European countries, suggesting that lifestyle factors or genetic background, rather than biological age, contribute to the etiology for birth defects in younger mothers. Other studies have hypothesized that adverse pregnancy outcomes in younger mothers can be attributed to non-biologic factors such as socioeconomic status, predictive lack of health insurance, and appropriate prenatal care, including supplementation with folic acid containing multivitamins. Several studies propose that the association between young maternal age and poor pregnancy outcome, including birth defects, is related to biologic factors such as the mother's gynecological immaturity and nutritional status. Fetal growth and development is highly dependent on placental growth and transport of nutrients. And in adolescent pregnancies, competition for nutrients between the developing adolescent and the placenta and fetus may result in adverse pregnancy outcomes. Additionally, teen mothers are more likely to smoke, drink alcohol, and have poor diet, resulting in greater nutritional deficits compared with older mothers.
Totally makes sense. So older maternal age is associated with risks such as problems with fertility and therefore increased need for assisted reproductive therapies such as IVF, multiple births, and chromosomal anomalies. It is widely recognized that older maternal age is strongly associated with chromosomal birth defects such as trisomies 13, 18, and 21. Several studies have also observed an association between older maternal age and non-chromosomal birth defects such as neural tube defects, cleft lip or palate, congenital inguinal hernia, and cardiac defects. Advanced maternal age leads to increased early fetal loss because of the impact on chromosomal and genetic disorders in older mothers. Biologic factors such as ovarian age are thought to contribute more to adverse pregnancy outcomes than non-biological factors. Ovarian follicles established during fetal life exponentially decline in quantity and quality over the years, resulting in reduced fertility as early as 30 years of age. In addition to decreased ova quality, age-related increases in comorbidities such as hypertension and gestational diabetes contribute to increased risks for pregnancy complications and possibly birth defects. Advanced maternal age is also related to preterm birth, fetal growth constriction, and stillbirth.
That's a lot of information.
So Lauren, that was some older studies,
Yes.
and that's kind of the normal of what we hear.
Yeah.
We found a semi-newer study in the last 10 years that kind of disputed some of that stuff.
Yeah, so little information has been available regarding the association between age of the mother and risk for birth defects that affect different parts of the body, such as the heart, brain, kidney, bones, or digestive system. However, a 2014 study, which is a relatively newer study for pregnancy, crazy that is newer, found that women aged 35 and older face a lower risk of having children with birth defects known as major congenital malformations, which are physical defects that are not caused by abnormalities in chromosomes. So the previous study had mentioned that it's widely known that advanced age and abnormalities in chromosomes go together. But this is saying that other congenital malformations are lower risk. In the new research, the results of second trimester ultrasounds were studied for more than 76,000 women. The researchers found that older mothers, aged 35 and older, were 40% less likely than younger mothers to have a child with one or more of the birth defects known as major congenital malformations. Some of the experts in the field of obstetrics and gynecology have called this particular study weak, however, because they are looking at mothers only in the second trimester. And while overall demonstrating better outcomes, looking only at second trimester does not account for the higher rate of miscarriages or fertility issues that many over the age of 35 experience.
I feel like the fertility issues is not the same argument, but the miscarriages, yeah, they have a good point. Anyway, Lauren, what I personally want to know, and what I was hoping to find in the studies, is information on whether an older, healthy mom has increased risks in childbirth compared to a younger, average health mother. Because we're not healthy as a society. As we get older, we get less healthy in general. And recent studies show that over 50% of people age 18 to 25 are already overweight. So pregnancy with obesity and birth risks. A 2003 populations-based control study measured BMI and then compared the risks for obese women and overweight women with average weight women. They found that pre-pregnancy obese women, so they were obese before they got pregnant, were more likely than average weight women to have an infant with spina bifida, omphaloceal, which is a birth defect of the abdominal wall, heart defects, and multiple anomalies. Pre-pregnancy overweight women were more likely than average weight women to have infants with heart defects and multiple anomalies. So this is what I expected to see, because as we went over in our obesity episode, it is a devastating disease to your entire body.
Yeah.
And I couldn't think of a reason why it wouldn't be a devastating disease to a pregnant woman who is having more things that need to go right in her body in order to have a healthy pregnancy.
Yeah.
So this is exactly what I thought we would find, and this is what I was hoping we would find a ton of studies on. And unfortunately, we found a couple. Well, fortunately, we found a couple. Unfortunately, we didn't find much.
More than that.
Yeah.
So there was a 2021 study. This is like probably the newest study that we found that looked at pregestational versus gestational diabetes. So gestation is basically the term that we use from the time between conception to birth. So pregnancy, pre-pregnancy versus pregnancy diabetes. So their results confirmed strong associations between maternal diabetes and cardiovascular, renal, genitourinary, and musculoskeletal anomalies. It also presented evidence that maternal diabetes is associated with a broader range of birth defects than was previously reported. They found that pregestational diabetes in particular, so having diabetes before being pregnant, is associated with markedly increased risk for many specific birth defects. There was a 2-fold increase in the birth prevalence of any monitored birth defect for women with pregestational diabetes compared to a 1.2-fold increase for women with gestational diabetes.
So that's a 100% increase versus a 20% increase if you got diabetes during gestation. And I don't know enough about diabetes during gestation to know if that's preventable or what the deal is with that. But that totally makes sense. Again, just like the obesity, like diabetes is a terrible disease, and it affects your entire body, can make you go blind, can make you lose limbs because you can't heal, all sorts of things. So it's not surprising at all that mothers with diabetes would have significantly higher risks to their pregnancy.
Yeah.
So another study that was relatively new, we found a Canadian study that specifically the authors were looking at cerebral palsy, but they had a lot of interesting findings in this study. The risk of cerebral palsy increased by 30% at the 40-year mark for the mother. So if the mom was 40 years or older, they had a 30% increased risk compared to the control group, which at this point was 20 to 39 years.
Wow.
So they were looking a little older.
Yeah.
But it also increased by 60% in teen pregnancies up to 19 years old.
Whoa.
Yeah.
So more.
Way more, well, double the risk
Yeah.
of cerebral palsy if you were 19 or younger when you were pregnant.
I did not know that. That's interesting.
Yeah, well, it gets more. It's not good for young mothers. Yeah, teen pregnancies are tough, it seems. And I would guess that there's a lot of reasons for that. One, you're immature. Two, you probably have less knowledge of general health, less care of general health.
Prenatal care for sure, nutrition.
I would also guess that teenage mothers are not typically in the higher socioeconomic status.
Right. Yeah.
I would guess.
Yeah.
And don't have a ton of help from their family in general when compared to other people. Yeah, exactly. So mothers that were less than 20 years old, again, were 240% more likely to have babies with congenital malformations. Women over 35 were 250% more likely to have in vitro fertilization used. So they had decreased fertility. Um, Women over 35 were also more likely to have hypertension, gestational or pre-existing, so that's high blood pressure, and 10% more likely to have a C-section. The hypertension doesn't surprise me at all. Again, as we get older, we generally get less healthy. Women over 35, their babies were not significantly more likely to have a malformation. There was no association between maternal age of 35 or older and preeclampsia, chorioamnionitis. I think I said that right.
Yeah, I think so too.
Preterm birth, encephalopathy, asphyxia, or congenital malformations. And there was no association with maternal age and prematurity. So basically, they didn't find a whole lot of problems when you were older other than getting pregnant in the first place. And then you were more likely to have hypertension and a small increase, 10% more likely to have a C-section.
Yeah. Well, yeah, I saw that come up a few times in the research too, the C-section thing, which
it seems pretty common in almost all the research that I read.
Yeah. So, in conclusion, the rate of live births among teenagers in the United States is one of the highest among industrialized countries, and many studies show that birth defects among teenage mothers are a public health concern. Similarly, rates of live births among older mothers are increasing, and although there may be associations between biologic factors and certain birth defects that cannot be modified, modifications in lifestyle factors can help to improve infant outcomes. Regardless of age, women who optimize their health before conception and are aware of information on all risks and potential prevention opportunities, such as smoking cessation and supplementation with folic acid, can reduce their risks for birth defects. So, go ahead.
Yeah, so I think in conclusion, we can't conclude anything, right? Basically. It seems that it's very, very likely that the increased risk in women as you get older is mostly, if not all, because we have increased health problems as we get older in this country, especially. Also, another thing that comes to my mind here is that we alluded to the increased maternal problems in this country compared to other countries, and then we talked about the teenage pregnancies having so many problems, and we talked about teenagers being way more likely in this country than other industrialized countries, which is what we were studying in that episode that we did not actually produce. Right. And that our increased risk of teenage pregnancy, if you will, in this country probably explains a lot of our decreased success in maternal health.
Yeah.
I'm guessing that if we looked into that closer, we would find that.
I'm sure. Yeah, I'm sure that that's related.
Yeah. So what would be interesting is looking at women that are 20 and older, in our country versus all the other European, Japan, those countries that are similar, Canada. Those countries that have similar, wealth to us, and seeing if those pregnancies, we don't have similar results. And I'm guessing we have similar results, and it's going to be the teenage pregnancies that skew our pregnancy stats downward.
Yeah.
Anyway.
Yeah. Overall, just more research needs to be done on pregnancy.
Yeah, way more research.
Way more research. But I think the thing that I took away from all of this was that, I came into this thinking like risk for everything goes up after 35, which I think is kind of just what we're told, blanket statement, like 35 and up is more risks for everything. But according to some of this research, that's not necessarily true. Like chromosomal abnormalities seem to be associated. But
that was only one study that we even found that mentioned.
Yeah. But other studies, showed that like congenital malformations. Like other birth defects are not necessarily associated with older age. So I think for me, as like I'm not 35 yet, but I am approaching it and wanting to be pregnant. This has kind of been a very like scary and like on my mind topic all the time. And so that's part of why we wanted to do this episode, just to like maybe reduce some of that fear involved in like being an quote unquote older person who wants to be
Potential
pregnant.
mom.
Yeah, potential mom. Yeah.
Did we decrease some of your fear, Lauren?
Yeah, I would say so.
My job here is done.
Thanks,
Thank
Travis.
you. Thank you, everybody, for listening. And we'll see you next week. This was fun, Lauren.
This was fun. Great job, Travis.
Great job, Lauren. Thanks, everybody. Bye.
See you next time. Bye.
Thank you for taking the time out of your busy day to listen to this episode of the Health and Happiness Podcast. We hope you enjoyed the episode and are getting benefits from our content.
If your life is improving in part due to the information in this podcast, we would greatly appreciate you sharing the episode with your family and friends on social media and leaving us a review so we can continue to reach more people and improve the health and happiness of the community at large.
Thanks again, and we will see you next week for another episode of the Health and Happiness Podcast.